Good afternoon to everyone. My name is Peter Gentala, and I serve as the chair. This is the DCS Community Advisory Committee. First and foremost, we want to welcome all the members of the public. Thank you for being here. We appreciate your focus on helping vulnerable children in our community. We have an exciting turnout. A number of folks have joined this meeting by phone, and we want to welcome all of you. Just as a matter of housekeeping, we want you all to know that we will, as a matter of practice, be muting all of the phone calls that come in. And I'm also going to ask the committee members to assist us just keep an orderly meeting by muting their sound until they're recognized to speak. And we'll have a good test of this right now because I'm hearing some road noise. So probably someone who's joining us by phone. Some traffic noise in the background. So if we could have staff go ahead and mute that if they have a chance to do that. Thank you. A couple of words about how to run this meeting. We would just ask everyone who's a committee member or DCS staff to keep your camera on during the meeting. So it'll help us recognize you, and it'll help me as I try to run the meeting to recognize if you've raised your hand to be recognized. It does help to phone if you're not speaking. So thank you for doing that. We're not going to be using the chat box at all. That is just going to add another level of complexity. And since this is a public meeting, it really doesn't help to have a side conversation happening in the chat box. So please understand, if you put anything in the chat box, it's not going to be checked. I'm not going to be using that to chair the meeting. And the way to be recognized by the chair is to use the raise hand function if you're connected by video. There's a second way, and I'll cover that for our members who are joining by phone. But members, if you just look at your software, there in the middle, there's three dots, and right to the right of it, there's a raise hand function. So just as a test, let's all raise our hands just real quick. If you're a member of the committee, would you punch that just so we can see that it's happening? It looks like everyone found it. Did anyone joining by video, any committee members not see that raise hand button? Okay, very good, thank you. You can put your hands down. I appreciate you doing that. Now, if you're a committee member and you're joining by phone, I'm not going to be able to see it, obviously, if you raise your hand. So what I've asked you to do, there'll be different times during the meeting that I call for questions or comments from the committee. And if you just get my attention by saying, Mr. Chairman, we recognize you so that we don't talk over each other during the committee. So thank you for doing that. All right, at this time, what I'd like to do is just have introductions. I already shared my name, but again, for anyone joining, my name is Peter Gentala. I serve as the chair. This is the DCS Community Advisory Committee. I work for an organization called the National Center on Sexual Exploitation, where I serve as senior legal counsel. And our organization focuses on the different ways that all forms of sexual exploitation are tied together. Not the least of which would be things like child sex abuse and child sexual abuse material that's distributed on the internet, things like that. I also serve on the Arizona Child and Family Advocacy Network board, and that's the association of all the child and family advocacy centers in the state that conduct forensic interviews and forensic investigation of child abuse victims. I'm going to try and call on each member that I see listed here, and I'll go through the ones that I for sure see. If you just introduce yourself and explain your organization and the role that you serve on the committee. Let's start with Robin Pearson. Robin?
It's Robin Pearson.
Hi, Robin.
Hello?
Go ahead.
Okay, if you can hear me, okay. Peter, can you hear me?
Yes, we can hear you fine, Robin. Go ahead.
Okay, this is Robin Pearson. I'm the Executive Director of Voices for CASA Children, and I'm supporting CASAs on this call. I'm going to star 6.
Thank you, Robin. Debbie Burdick, please. Hi, Debbie, you're muted.
Sorry. I'm Debbie Burdick. I am the superintendent of the Cave Creek Unified School District, and I am on this advisory committee representing the school sectors, especially public schools.
Thank you, Debbie. Judy Krisick. Judy, are you there? Judy, it looks like you're muted.
It says she's unavailable at
Okay.
this moment.
Maybe her internet connection went out. Let's move to Rita. Rita?
I'm Rita. I'm Rita Wright. I'm an assistant clinical professor in the social work department at NAU. I coordinate our child welfare training program, and I represent rural communities.
Terrific. Thank you, Rita. Bonnie, please.
Hi, I'm Bonnie Diedolf with the Arizona Council of Human Service Providers. We are an advocacy organization, and I believe I represent child welfare advocacy organizations or something like that. I never quite get it right, Peter. Someday you'll send me a note and then I'll get it right.
It's because you do so much and you all do so many good things. We have to pick one. It's hard to do. Thank you, Bonnie. Welcome. Glad to see you. Jacob.
Good afternoon. I'm Jacob Schmidt. I'm the president and CEO at Arizona's Children Association, and I'm here representing the foster care provider community.
Great. Thank you, Jacob. Mark, please.
I'm Mark Upton. I'm the president of Christian Family Care, which is working with strengthening families and serving kids in our community. And I represent the faith community.
Thank you, Mark. Okay, and now I'm going to have to ask to see if I've missed anyone. Judy, we missed you earlier.
Yeah. Yes, I'm sorry, I missed the call. I'm here. I represent Child Welfare Research. I'm at ASU School of Social Work.
And Suncier Swift is on the phone as well. It is on the call
Great.
As well.
Hi, Sanciera. Would you care to introduce yourself?
Okay.
Peter, somebody has their hand up. I'm not sure who it is.
Jennifer Huber raised her hand. She's also on the call.
Hi, everybody. I am also a committee member. My name is Jennifer Huber. I'm a professor of special education, but in this format, I represent a foster adoptive parent.
Fantastic. Thank you, Jennifer. Sorry I missed you there. Okay, is there anyone else? It sounded like Sanciera was at least with us for a minute. Is she still on?
Yes, I know she's on the call. Oh, okay. I will check.
Okay, well, we will jump back into introductions if she becomes available. Anybody else that I've missed? It looks like it's, is that everyone that you had who was RSVP'd, Felix?
Yes.
Okay. Well, thank you for introducing yourselves, everyone. Thank you for making time to hold this meeting. Just a reminder, the meeting is being recorded. This is an official public meeting under Arizona law. And so we're going to do our best to honor that responsibility and discharge our duties as a committee. Thank you for accommodating and serving your community and serving the department by joining us. We're going to turn to the first agenda item after introductions. That would be number 2, and it's trends in the placement of children in foster care in light of COVID-19. This has become a standing agenda item for us since the pandemic began in earnest, and we typically have someone from the department. Often the director himself has helped us with just having an understanding of what the department is doing when it comes to responding to the challenges provided by COVID. So at this time, I'll just request the department to just identify who's going to be our presenter, and we'll get you going on your presentation.
Okay, well, Gillian is on the line. She's going to be our presenter. I also wanted to mention, Peter, that Jessica Anthony, who is the new ombudsman, is online, as well as Lynn Hart, who is assistant to Jacob Shalom, DCS Deputy Director, and Cynthia Weiss, our Communications Director, is on, and Magdalena, I missed your last name and I didn't write it down, Magdalena. I apologize.
Cortez.
Can you introduce yourself? Jorge. Okay. Thank you.
Thank you, Peter.
Yes.
She's online as well. And
Great.
I think Sue Smith from the Office of Prevention will be joining us. So those are the DCS folks online. I wanted everyone to know who they were.
It's a great group. Thank you for joining us. I appreciate it.
And I will turn it over to Gillian.
Hi, everyone. Thank you so much for having me present again. I'm sorry I'm not the director, so hopefully I do the job justice today. We're having connectivity issues, so I'm talking to the screen, but into my phone, so hopefully it sounds okay. I do not have a presentation, so I was just going to kind of give some talking points, and then of course if there's questions, I'm happy to answer any questions. So Felix sent me over what I would be discussing today, so the trends of placement of children in foster care in light of COVID-19, and then a little discussion around distant learning, and then statistics around testing for children in care. So I thought I would start with the testing. So we have bi-monthly calls with our congregate care providers and our FAS partner agencies, as well as monthly calls with our community partners, and we've started to share our youth who have tested positive. So since March, and this data is as of September 29th. Since March of 2020, we've had 185 youth test positive for COVID-19. All of the youth have recovered. We currently have no, as of Wednesday the 29th, we had no active cases of COVID. We've been watching the numbers based on age and placement type, and the majority of children that have tested positive have been in a congregate care setting over the age of 13. So we're thankful that the numbers have stayed, relatively speaking, low, considering our population of almost 14,000 kids in out-of-home care. And we're thankful that none of the children have required hospitalization or had any, created any major barriers for them. Following that, I was going to go into a little bit about testing. And it asked about both children and then also our DCS personnel, and it's two different processes. But several weeks ago, we partnered with Banner Urgent Care for rapid testing, and that was kind of during the peak when it was hard to get results turned around quickly. which has improved greatly since that peak in, I think it was July. But so caregivers notify us through our CMDP inbox that they have a youth that has been exposed or is symptomatic of COVID-19. We turn around and issue a rapid notice to provider, and then we give them all of the information for the Banner sites, and they can go make an appointment at a Banner urgent care and get those results turned around really quickly. In addition to that, we have found a pediatric office in Chandler that has been a wonderful partner for us that does rapid testing, and many of our congregate care providers have been using that office they get instant 15-minute tests for the children. One of the barriers with that is they do not do the PCR testing, which now that several youth are back in school, if a child is exposed or has symptoms, the schools are asking for a PCR test. So we're monitoring that, but we still have the Banner option. For DCS staff, we've had rapid testing for quite some time now through our partnership with ASCO. And so we're able to make appointments, and the turnaround is very quick and we don't have to have symptoms, or it's just available to us based on our first responders. So that sort of covers the testing component. We also have a partnership with a mobile unit that will go to group homes. If a whole house needs to be tested, they can outreach, and then CMDP sends the mobile unit to the home, and we'll get all of the youth tested with quick turnaround results as well. In terms of, I guess I'll stop there and just see if anyone has questions, or unless you want me to continue. Okay. In terms of placement since COVID began in March, when everything started, I've had to pivot on our plans for our recruitment campaigns and things of that nature for foster care. And we issued several temporary considerations to support FAS agencies, continuing with recruitment while trying to still meet the needs of licensing. We did do foster parent college several months, and then we launched what was called the You Are Essential campaign. I believe I spoke with you guys a few months ago about that campaign. We've had really good results with that campaign over the summer, and so we're thankful that our community has wrapped around us and wants to continue to support this DCS community. So I wrote down some numbers for all of you today. In the month of August, we generated 680 leads, both through our natural website and then through campaigns that we were issuing. As many of you know, I monitor our gains or losses in foster families, and I do subtract kinship families just for the purpose of recruitment, because they come to us more through a different lens. But in the month of May, we had an increase in foster families for the first time since I've been in this role, of 5 families, and then we had another increase in September of 2 families. And so they're small numbers, but it's positive for us to see that in working together, that our community is coming to meet these needs of children in care to place in a family-like setting. We also watch our kinship placement, both as a first-time placement type and then my overall number of kinships. And so in June, we saw, and this is first placement type into entry, but in June, we were at 57%, excuse me, of children being placed into kinship as their first placement. And then as of September 26th, we have almost 7,000. It was 6,900 kids placed in a kinship setting. And so we've really been working throughout the summer to make sure that kinship are considered as a placement, and then also working with foster families. As many of you are aware, the DCS website, we've been communicating a lot, and so we have seen an increase of children at our Welcome Center, due to, reports of abuse or neglect, and we've reached out to foster parents directly, as well as with our FAS partners seeking help to ensure that children are being placed in a family-like setting. As we go into the fall, the campaign, the You Are Essential campaign has sort of slowed. And so we'll get ready for the holidays and then National Adoption Month. Our marketing team and our recruitment team here at DCS, and we've been working with FAS providers, are trying to prepare for what it'll look like as children go back into school, and a possible increase in children coming into care. And we want to make sure that those kids are placed in a family-like setting whenever safe and possible. So working through those. The last piece of information that I was going to touch on today, and I don't know when the last meeting was, but in terms of distance learning and our protocols around that, there was some miscommunication in the news about some messaging that had come out from the department. And so I'll clarify it to the best of my abilities today. The department does believe that children can best learn in-person, teacher-led environments when it is safe and appropriate to do so. And so we did issue that communication around July 6th of 2020. With that being said, we also recognize that there are some circumstances that will require an exception to that process. And so kinship and foster parents exception to in-person teacher-led learning when school districts make those available by accessing our education point of contact in and it's education POC at AZDCS.gov. Through that, they get matched with an education liaison that has a standard work to basically work with the caregiver, and they notify the DCS specialist, ensuring that they have everything that they need to meet that child's educational needs and goals. If the child has an IEP, which 26% of our school-age children in care have an IEP or 504 plan, then they also have a process to ensure that we're meeting the needs of that IEP. They'll work with the local authorities, foster liaisons for the schools, if necessary, to make sure that the child has the equipment that they need and the support that they need to be successful. So far, and I apologize, I don't have the exact number, but about 85 kids have been approved in that exception process. We issued communication in September, just reminding our fostering kinship caregivers that that process is there and available to them should they need it. In addition to that, we issued some communication for congregate care learning or congregate care placements in terms of using the learning labs that schools were required to have through the executive order. When school started August 17th, we found that there was several barriers to learning labs. There was wait lists and other challenges that youth were facing in those environments. And so we created a similar exception process for congregate care providers to request that they could go a different route. And the process is the same. You're working with an education liaison to ensure that our focus and that our priority is children's educational goals being met and that they're being supported in their learning environment. So that covers everything that I have for today. So if there's questions.
Thank you, Ms. Vanessa. Committee members, any questions? Judy Krissick, please.
Jillian, thank you for your report today. There's a lot of good news in that report. I was kind of amazed at if I got this right, 57% now in kinship care. I'm just wondering if there are any particular practices you attribute to that increase.
So I want to clarify my statement. We measure first-time placement, so kids entering congregate care and kids entering kinship or family-like setting. So that chart is specific to their first placement was a kinship placement. So the stability of children in kinship care is potentially different. But we have seen, just in the last month, I think it's 150 kids have increased in kinship placement. So 6,900 is the highest I've seen in quite some time for kids placed in kinship care. I think that I attribute it to the pandemic and people maybe being better connected and outreaching for supports, in addition to our team's efforts in finding placements. Due to low volume of reports and kids coming into care, there's I guess better demands or opportunity to research placement types.
Thank you.
There is one thing I apologize about, in regards to testing. As part of the White House efforts, the department has received 1,000 Abbott rapid tests for 15-minute test results. And these kits are expected to arrive before the weekend, and we'll be utilizing those for the Welcome Center when children come in symptomatic or having been exposed to COVID-19.
Thank you. Members, are there any other questions? Bonnie. Bonnie, you're on mute.
6 months. You'd think we'd figure this out after 6 months. Sorry. Gillian, what's happening with the numbers of kiddos in congregate care? Is that staying the same? Is it going up? Is it going down? I know we're glad to hear about the kinship care numbers, but we're also always going to be worried about the congregate care numbers.
So I did not prepare notes on that for today, but the last time I checked it, which would have been about 2 weeks ago, the number has stayed pretty much the same throughout COVID. We've seen it go down very slightly, but then as we've seen kids increase at the Welcome Center over the past couple weeks, we've started to see the uptick of children coming into care, and so that number has stayed pretty steady.
Hey Gillian, it's Mike. I think I can help you with that. I have it in front of me. This time last year, so if I look at the same week, the end of September, in group homes, kids 0 to 17, there was 1,602. And this year, on the 26th of September, it's actually 1,553. So it's gone down slightly on a population that's 14,507 versus 14,610. So the population's up about 100 kids, and you're down about 50 kids in group homes.
Thank you, Director.
Thanks for that, Mike.
Thank you, Bonnie. Any other questions?
Mr. Chair, this is Sunsiri, so if I have a question.
Yes, please go ahead. Thank you.
I figured out how to unmute myself. So I actually am a therapeutic foster parent. I have been for 14 years. We are licensed for 3. So one of the questions that I have is, what is the protocol for children moving around? Because I've noticed even within my own agency that a lot of families are really hesitant to take children from actual group homes because they may have been exposed to COVID and they're not really sure. Are you guys putting any type of protocol maybe in where if a child moves from a bigger group home into a regular home that they're being tested? And I also would like to say too, I was personally going to take a child probably like a month ago, and that's something that I had asked of my agency. And when they actually did test the child actually was positive. But if it was not for me asking, that would not have happened.
Thank you. So the answer to the question is the department has has been consistent in our messaging that we will test children when they are symptomatic or have been exposed to COVID-19. We are not testing children just because they've entered care. We don't want that to be our practice. For children from congregate care, if there's been an exposure in the home, we have I think they call it contact tracking, not contact tracing process. But the group homes notify us the minute whether a child's been sent home from a learning lab or from school, or a staff member has tested positive or been symptomatic, and we immediately quarantine the home. We have a process where we notify all of our field specialists that the home is under quarantine, and so no transition of children from a congregate care setting would be occurring if they've notified us and we've entered a quarantine period. In addition to that, we have these partnerships to get those children tested. So I think I half answered your question. I'm not sure what happened in the specific circumstance of why that youth wasn't tested prior to you requesting and what their exposure had been. But we've been communicating again regularly with the group home providers, utilizing our contact tracking process to outreach anyone that's been to a home, that whether a DCS field member has visited a home recently that then goes under quarantine, we notify those people so that they can go and get tested.
Thank you.
Thank you. Jennifer Huber.
Is similar and along the same lines. Is there any testing protocol for foster parents for when students move from one foster home to another? Do we know that the foster parents are not positive?
So that same process exists we don't have a testing process for the foster parents, but for the foster children, again, if a foster parent became positive or exposed to COVID, they would go through that same process. Usually it's their licensing worker that's notifying us, but they email that CMDP inbox. We can do the notice to providers for the youth. If they've been exposed or symptomatic, that is when we'll test them, and then we partner with urgent care facilities to get the youth tested as quickly as possible.
So I understand you're doing that with kids, but there's no protocol to test parents at all.
Correct.
Sorry, thank you. Any follow-up or additional questions? Okay, that was a really thorough presentation. We really appreciate it. It's extremely helpful to have this information. There was a lot of really encouraging information there. It's good to know in particular that the infection rate was so low for the whole population over the course of that time. That's really encouraging news. So thank you for sharing that and everything else. Members, last chance before we move on to the next agenda. Anything else? Okay, thank you.
Thank you.
I appreciate it very much. Thank you for the presentation. We're going to move to agenda item number 3, racial disproportionality and disparities in child welfare. This also is a department presentation. Who will be presenting for this agenda item?
Peter, this is Catherine Guthrie, and I'll be presenting.
Hi, Catherine.
Hi. Before I do that, Director Faust is on the call as well, and I know this is an issue of such importance to him. I'd like to ask him to say a few words before I get started.
Yeah, thanks, Catherine. Catherine's going to run you through some data and show you just the facts of where we are. We're looking hard at, and I'm sorry if I don't have my camera on, we're having connectivity issues in the building. I guess I can't say that if Catherine's in the same building and has her camera on. Okay. So we're going back and looking hard at, the culture of our organization, how it fits into this overall thinking, and the data that we're seeing regarding disproportionality in care, looking at and having deeper conversation around implicit bias, and just how all of this fits into the broader conversation. I think it really starts with us having very open and candid dialogues with which for some people is an uncomfortable situation to get into, you know, how complicated of a matter this is, how ingrained it can be, and how challenging it is based on the community in which you live. I was on a call yesterday with peers from all over the country, cities like New York, Philadelphia, Pittsburgh, Los Angeles. And although we all face similar challenges with disproportionality of children in care, and as well as the referral of children from certain communities to the child welfare system, we all have very differing approaches, of very differing communities, very different solutions to those matters. So we are taking a step back as an organization, asking ourselves some deeper questions of, do we have the right partnerships? Do we have the right conversations going on? What do we have to do differently? And that's really going to start with the creation of a diversity council in our organization that's inclusive of our staff at all levels. And we're evaluating whether or not that includes existing or former foster youth and other external engagement. And so as Catherine walks you through the data today, there's some things that, you know, they might be shocking to some. They're not, you know, not shocking to others. And I think it's important that we use this time in our communities as a catalyst for these dialogues, but it's not the sole catalyst, nor as the, I'll say the amount of communication that's happening in the community starts to quiet. It's important that we keep these conversations fresh within these circles to make sure we're making forward advancement, because these are people's lives that we're impacting. So how do we engage more meaningful, more effectively? And how do we understand barriers and perceptions from both sides of the equation, from the child protection agencies perspective coming into a community? And then do we really understand how the communities view us? And do they view us more as a law enforcement agency? We feel like we're there to help, but do they feel like we're there just to disrupt their family? And unpacking and understanding that with a greater level of understanding is important before we can even get into meaningful work in this space. So this is going to get tied into one of our strategic objectives for the next several years. So I appreciate the opportunity of just being able to make a few comments, and Catherine will walk us through some details as we go forward.
Thank you, Director. Armando, are you able to pull up the slides that I sent? Thank you. So if you want to go to the second slide, Armando, I want to share some data. I think, you know, the place to start with this conversation is always just to simply acknowledge what we probably all know, that there is disproportionality and overrepresentation of Black and American Indian children in our child welfare system when we look at several different metrics. So I want to start there with acknowledging that, and also say I'm really glad to be here at this meeting with this group of people, because I think that there's no doubt in my mind that the decisions that are made in different sectors of the child welfare system contribute to the situation that we see in child welfare. Our decisions affect the decisions of our partners at the court and at provider agencies and in schools and in law enforcement, and there's a reciprocal relationship there that has a cumulative effect on families. So, I hope that as you're listening to this, you'll be thinking about how the decisions and the practices within your own sectors in the child welfare system affect these same outcomes. So I want to start by looking at just some very, probably the most basic about disproportionality and overrepresentation in the out-of-home care populations. This is probably the most common statistic that people see first, and that is showing a comparison of the percentage by race in the general population compared to our out-of-home care population. So you can see here that Black children are 4% of the population in Arizona, but at the point that this data was pulled, 16% in our out-of-home care population. Whereas we see an underrepresentation of Hispanic and white children compared to their percentage in the general population. And I'll just say, at any time, if you want to raise your hand, if you have a question, please feel free to ask to those of you who are members of the panel. The second data point here is the ratio of entry to reported children. So this is comparing 3 statistics on rate per 1,000 children in the population. So for example, 96 children per 1,000 in the population of Black children will be reported to us in a year. Hold on a second, I need to trying to get rid of this bar so that I can see these better. Okay. So 96 of every 1,000 children in the population will be reported to us, whereas 19 of 1,000 Black children will enter care, and 31 per 1,000 are in care. So the important thing here is to see that one in 5 of Black children who are reported to us enter, 1 in 11 for Hispanic children, and 1 in 7 for white children. Do you want to go to the next slide, Armando? This one is going to take a second for me to explain. If you're not familiar with racial disparity indices, it might take a second to get a handle on this one. So feel free to ask questions if I'm not clear. So what we're seeing here is a comparison between the percentage by race of the general population then to the population. But then we compare that percentage to the next event. So for example, when we're looking at the entered in foster care, this is the percentage by race compared to the percentage of those children reported. Now, what you see here is that there's a scale with a line at 1. So if the ratio is 1 to 1, that the same percentage of children entering care, that matches the percentage that are reported to us, then there's no additional disproportionality occurring at that next event of entering foster care. I don't know if I can see if I have if what I've just explained made sense. Can you give me a thumbs up? All right, Bonnie. I'm not seeing many thumbs. Right now.
Data already. So
I don't know how to do the thumbs, but yes.
All right.
It looks like we have a couple of questions.
Okay, good.
Or are those thumbs up? Judy, do you have a question?
Mine was thumbs up. I'm sorry.
Okay. All right. So basically, what we're seeing is, you know, you can't be at risk of entering foster care unless you've been reported. So we look at just the percentage of children who have been reported, and then see, is there a higher percentage entering foster care compared to the racial frequency of those who are reported. This by each racial group. And so what we see here for American Indian children is that they are reported to us. The first blue square here is above the 1 line, so their percentage among children reported is higher than their percentage among children in the general population. So there's an overrepresentation of American Indian children being reported to us. Then when we compare the children entering foster care to that percentage reported, we also see that that is above the 1 line. Then we look at the of those children who entered foster care, what is the percentage comparatively of those who were reunified and the percentage of those who were adopted? So here we see that the racial disparity index is below the 1 line, which means that their percentage among those who were reunified and were adopted is less than their percentage among those who entered foster care, which suggests that there's some room to improve the rate of reunification and adoption for American Indian children who enter care. When we look at the Black children, what really stands out is that first circle on the on reported. So Black children are reported at a rate that is 3.5 times rate in the general population and are underrepresented at the point of adoption. So at the entering foster care and reunified, it is on the 1 line, just very slightly above. So what's interesting there is that while there's a very high rate of report of Black children compared to children of other races, there's not an additional disproportionality being added at the point of the decision of entering foster care. However, it also, we might ask ourselves why, if they're being reported at a rate that is so much higher, then we might expect that there would be a lower percentage who would actually enter care compared to that high portion of children being reported to us. I'm gonna pause for a second and again just check for understanding and see if any members of the panel have any comments on this data.
Thanks, Catherine. Judy has a question.
Yes, and I'm just wondering if for American Indian children, if we looked at guardianship, if we might see a higher likelihood of that, or are the numbers too small to look at guardianship this way?
Thanks for the question, Judy. I probably would be small, but I think that it's important that I look at that. So I intend to do that. I also want to look at the proportion of children who exit to age of majority. That's another important exit reason that we want to see if that varies by race as well. So that's another data point I'd look at.
Thank you.
You're welcome.
Thanks, Judy. Mark has a question.
Mark just needs to get his mute undone. When I just clarify, did I hear you say, Catherine, that the on the Black children, the reporting's high, but the entering foster care is not there's not the disparity there? Am I understanding that correctly?
So what we're taking is the percentage of children who are reported to us who are Black, and then comparing that to the percentage of children who enter foster care that are Black. And what we're seeing is those two percentages are very similar. So what that means is that, you know, we saw on the previous slide that there's still overrepresentation of children compared to their peers per thousand in the population. But the contributing factor that a lot of that is explained by the percentage of children reported to us. There's not an additional increase in that percentage at the entering in foster care. And that's important because it does give us some information about where we might target strategies to impact decisions. There's a decision being made to report to us. There's also a decision being made to screen in a report. And both of those contribute to that rate of reporting that is 3.5 times greater than the proportion of the population. So it just leads us to some thinking of there's an opportunity for us to be addressing decision making around reporting and screening in practices, and even prior to that of what services and assistance is available in communities before a person even comes to the attention of the school or law enforcement or whoever the reporting source is. So it just points us in a direction of where we might impact this issue And again, I want to say that's not to say that there aren't there are not impacts we can have around the decision to enter foster care, because I would actually expect that to be below the 1 line given that high rate of report.
Okay, thank you.
You're welcome.
So is there any other, maybe you're going to get to this, but is there anything that looks at the family structure, the marriage or single family, as to why the reporting might be different? As I think both Black and the Native American communities probably have a higher disparity there than the general population as well.
You know, I think at the moment we're at a point of just beginning to explore what the best variables are to look at. What are the metrics that are most of interest to people in the community, and we want to gather that information and then start to do some of that analysis around, you know, explanations potentially around poverty, looking at differences by you know, county potentially or zip code. There are many factors that we can look at, and we've only scratched the surface of that. So I think that's part of the initial conversation that needs to happen, particularly with members of these communities.
Great, thank you.
Welcome.
Thank you, Mark. Bonnie, do you have a question at this point?
I do. Catherine, have you looked at any of this data by report type? Abuse or neglect or something else? Since we know so many of the neglect reports are related to poverty issues, being able to tease out anything around that piece.
I do have some data in the next few slides.
Cool. I'll be quiet then.
No, I always appreciate your questions, Bonnie. Okay, we can go to the next slide. So one of the things that we were interested in looking at was the reporting source to see if that introduces any variation that might explain the differences that we just saw. And what we saw is that there's really not a lot of variation in reporting source by race, although slightly higher from law enforcement and juvenile court for both American Indian and Black children. So you can see those are the 2 orange lines in the top of this slide. So again, the scale of this is only 0 to 30%. So those differences that you're seeing are fairly small, but it does provide some information about some variation between those overrepresented populations and the underrepresented populations. Next slide. So this answers your question, Bonnie. We looked at the percentage of reports by neglect, physical abuse, and sexual abuse broken out by race, and saw that there is a slightly higher percentage of neglect for American Indian children. But this really doesn't, there's not a lot of variation here, certainly not to explain the high rate for African American children. In the neglect category, they had a slightly higher percentage in physical abuse. Next slide. So here we see that African American and American Indian children have higher rates of response time 1 and 2 reports compared to Hispanic and white children. So this may have some contribution to the higher reports and possibly related to those coming from law enforcement. The response time is based on the severity and immediacy of the danger and also child vulnerability. So age of the child is a factor. And also the immediacy of the concern and the danger to the child. So slightly higher rates of those 1s and 2s for African American and American Indian children. Next slide. So what does all this mean in terms of, what do we do next? So clearly what we've seen is that there is an issue. There's a problem to be solved here. There is racial inequity and overrepresentation of Black and Native American families in our system. And we can see, we've just started, like I said, to scratch the surface of the data to see that there are different decision points where we might begin to impact this issue, and that we also know that there are relationships, like I said, between the child welfare system and all the other systems that are involved with these families and come into contact with them in their communities and in their homes. Most notably, schools and law enforcement, who you saw are the leading sources of reports to the department for all families, and as well for Black and American Indian families. But, as the director was talking about, this is an extremely complex issue. There are so many factors that impact these outcomes. And so we have started by talking about strategies for relationships and problem exploration. We need to take the time to talk with people about their experiences, to look at the data that we have and start to collect from people the ideas like we heard today about what variables should we look at to try to understand why this is occurring, in order to direct us to the most effective solutions around those. But it really needs to start with building relationships and trust. We need to be able to have those, sometimes I think will be difficult, honest conversations. So that starts with inclusion, communication, and I think we also build trust by following through and taking action when we've determined what those actions should be. The director already talked about the development of the DCS Diversity Council that will first start to be talking about and focusing on the disparity in outcomes for African American families. And then organizational assessment. There's a toolkit that is scheduled to be released this fall by the Black Administrators in Child Welfare Committee. I'm not sure if that's what they call themselves, organization. But they are working towards putting a toolkit together to help agencies like us across the country to do organizational assessments and understand what is disproportionality. There are tools out there already. There are some organizational culture and competency assessment tools that we've been looking at to start to determine what of those might meet our needs as well. And then data analysis for both exploration and accountability. So, again, looking at that data for discovering solutions to problems and where we might target decisions, and then also for reviewing on a recurring basis to measure our progress, sharing that data so that we're accountable to the community and to each other, data that would describe what success looks like. Next slide, Armando. We also have some existing initiatives with opportunity for inclusion that we hope, if we do this well, will impact these outcomes. One of those is FFPSA and the service array revolution that you've heard me talk about a couple of times. We've had presentations to this committee about the work that we're doing around service array. In particular, right now, we are looking at the Family Connections program and the Nurturing Parenting program, both of which were selected in part because they have opportunities for us to make adaptations that would meet the needs of these families, and because they provide, Family Connections in particular is a social work program grounded in social work theories around problem solving, empowerment, respect, coaching, helping families to gain the skills or call upon the strengths that they have themselves and their families and their communities, so that we minimize the intrusion of the Department of Child Safety and other agencies in their lives, all of which is intended to reduce removal of children from families. So when we implement that program, we will be doing that with the intention that we reduce that rate of removal, and that we are serving some families early on so that we can reduce that report rate, because we should see a reduction in repeat reports to the department. A third program that I think is important here is team decision making. We've had this for quite some time, but there are opportunities for us to look at this in terms of how that is delivered and whether there are adaptations or ways that we can increase the number of family members and community members and supports who come to those TDM meetings for African American families. So I see that as another place where we can do some work that could have a real impact here. And then I think the next one is the last slide, Armando. So, one of the things that, I keep asking myself as I'm thinking so much about this is, are we going to be successful? I've worked for the department for a long time. This has been a problem for a long time. We've had initiatives in the past where we worked on our culture and cultural competency and practices at the department, trained people about disproportionality and history of oppression. And we're still at the same place today. And, we've been talking about this problem over, I've been talking with Mike, Director Faust, about this for several years. And, the time is right to do this now, I think, because so many foundational supports have been put into place over the last many years. We have done substantial work around our capacity as an agency, the workload of our staff so that they have more time to spend with families. We have worked on the implementation of practice models that support consistent decision making, not in a structured way that potentially has the potential for bias built in within a tool. But providing frameworks for people to use an engaging approach with families to understand their unique, special, individualized situation, their resources, their family networks, so that we can manage dangers and minimize our intrusion in those families, but with a consistent framework that we can be accountable to and that we can communicate to people and help people to understand how decisions are made at the department. And that we can monitor fidelity to internally. We've also spent substantial effort around a culture of safety within the department, both psychological safety for our staff, and also creating a learning environment and valuing an openness to change, all of which I think is so important to this particular work, that we need to feel psychologically safe to have difficult conversations, and we need to be open for substantial change in the way that we work with families in some situations. Accountability mechanisms are in place throughout our department, and this has been a huge amount of work over the last several years of setting up a management system that makes our work visible, that holds ourselves accountable, and allows us to provide oversight and fidelity monitoring of practice and with our service providers. And then finally, we've done a large amount of work around supervision. We have a new strength-based supervision process that includes some conversations about bias and assumptions we're making with families. So it's a starting point, but there's much more that could be done there. And we have a supervision coach program that helps to improve the application of the practice models and the practice standards and the skill sets of our staff in providing supportive, empowering social work to families. So I think we're in a good place. I feel optimistic that this is the right time for us to be working on this. So I'm going to ask Director Faust if he's still there, if he has anything that he might like to add at this point.
It appears that he's left the meeting.
Okay.
At least on my screen. So let's, pending him coming back, we do have some questions coming up. I'm going to open it up for questions, Catherine.
Okay.
Judy, go ahead.
Thanks for your presentation, Catherine. I find this very encouraging. And when you ask if we're likely to be successful, there's a couple of things that come to mind. One is that we manage what we measure. And so if we're looking at specific indicators and working towards them, we're so much more likely to be successful. And so it seems like you've identified a number of those indicators, which is good. You also mentioned selecting the evidence-based programs, which is also contribute towards success. I think that Mike mentioned inclusion of the communities themselves, which is so important. And if possible, hopefully training people in those intervention methods so they are delivering services to their own communities would be real positive. And also Mike mentioned that it's important what people believe. So it's not as much as what you're doing or think you're doing, but understanding the community's perception and working with that, which I think is very refreshing, this approach.
Thank you, Judy. You know, and you mentioned, you know, members of the community taking care of their own. And I want to ask Gillian to say a few words about the work that her team has been doing and our recruitment agencies have been doing recruiting foster families that match the ethnic and racial background of our children.
Thank you, Catherine. So I got a sneak peek at this presentation about 30 minutes before the meeting today, and I had reached out to Catherine, and I just wanted to highlight that we've done some pretty intentional work around our recruitment of foster families, and we had another win, another positive that I wanted to share. Last year, we launched a campaign called Foster a Future, and we had a subcomponent of Foster a Future for an American Indian child, and we've kept that campaign open, which we don't normally do. And last month, we got 132 leads on that campaign, and then another 37 for this month. In years past, we got maybe 3 to 5 leads in an entire year for Native American families. And so this campaign has done really well. We've created some print materials as well as social media materials to assist with this, so that when children do have to come in care, they're placed in a family that can meet their cultural and diverse backgrounds. In addition to that, we are redesigning our sort of landing page for foster recruitment and redoing our orientation video. And we're actually filming in the next couple of weeks, and we've been very intentional about making sure that we have a diverse population represented on that orientation, so that when people come to us, that you know, we're representing our community as a whole. And so there's been some intentional work there, and I just wanted to share that based on Catherine's presentation today, to acknowledge the work that we're doing to support this.
Thank you, Gillian.
Thank you. Please.
Thank you. Yeah, I'd like to echo what everyone else has said in terms of this is a wonderful presentation, and I'm really excited about the direction the department's moving in. I did have a question in terms of, does the department still have an ICWA specialist that helps with any of that? And then are there any MOUs that are in place with any of the tribal nations at all that we're working on?
Yes, so we have an ICWA liaison, and we also have an Indian Child Welfare Policy Specialist. So 2 people devoted to that, to our compliance with the Indian Child Welfare Act. And yes, we have, you know, we continue to meet with tribal social service representatives through the ITCA. And we also have separate meetings with the Navajo Nation quarterly to talk about our agreements with the Navajo Nation.
Thank you. Thank you, Jacob. Bonnie, do you have a question?
Thanks. We know that there are barriers to licensure for some kinship families. Are there also barriers that we need to look at in the licensing regs for African American and Native American families to get licensed to be foster parents? And I'm thinking of some of the potentially non-safety concerns that we could be looking at and easing up on those restrictions that we have in place.
Gillian?
So we have a project sort of on the placement array, and I can definitely look at that. I do not believe that we've looked at that previously or are aware of those barriers. I don't know if any of the FAS representation is aware of those challenges, but certainly that is something that we can look at to see if that's an area to improve and overcome.
Gillian, I'd love to work with you on that one.
Okay.
Because I could probably identify 5 things just off the top of my head that really are sort of silly life safety things, life safety inspection things.
Okay, yes, I'm happy to work on that and make that an easier process.
Cool, thanks.
Thank you for highlighting that, Bonnie. Members, other questions for Catherine or for Gillian? I'll ask a question at this point. Catherine, on the very first slide, or close to the very first, when we were breaking down the different areas, when it came to reports, you indicated that that whole reporting category demonstrates both number of reports raw coming in and then the disposition of the reports made by the department. Isn't that right? Did I hear you correctly on that?
The point I was making is that there are really two decisions that contribute to that number, because there's a decision of somebody to call us, and then there's a decision at the hotline of whether that report meets the criteria as defined under the statute to be assigned for response by the department.
Okay, thank you for highlighting that. I think understanding the data behind that would be really helpful, because it's all one thing in the sense of the outcome that a report is made and acted upon, but understanding the department's role in that would be really helpful, I think, to have a little bit more granularity on that. Looks like Judy has raised her hand. Judy, do you have a question?
Yes, I'm not sure it's something that can be answered, but maybe something that can be tracked or looked into, and that would be how much of maybe the overrepresentation and at least reports, maybe some of the other indicators are associated with parents being incarcerated. So African American and American Indian populations have also high rates of incarceration compared to their representation in the population.
Right.
Thank you, Judy. Members, other questions?
Mr. Chairman, this is Rita. I have a question.
Hi, Rita, go ahead.
Hi, I was wondering if we could hear more about the proposal for the DCS Diversity Council. Would that be an internal committee? I guess, who would comprise that committee, and what would, I suppose, the goals or actions of that council be, or has that not been developed yet?
It hasn't been developed yet, and I think that it's important that be decided by people who come from that community. We want people from diverse backgrounds to be on that committee, and I think that we need to hear from them about the correct makeup of the committee. Director Fausto, we're considering having either youth in care or youth foster care alumni on that committee, which I think would be very useful. We have a youth empowerment council here at the department made up of young people who've been involved in the system, and it's been fantastic. They're just so involved and given us so much information that's been helpful to us. And so we envision that this would be similar to that. And that youth empowerment council, they have elections for their own members. They run their own committee. We just provide support for them to be successful, and I would see this being the same.
Thank you. I had more questions.
Go ahead, Rita.
I think that we're all aware that there's a high correlation between poverty and child maltreatment. And obviously, minority populations are overrepresented in those SES brackets. So has the department considered legislative advocacy for policy changes related to public assistance programs in the state as a measure to prevent child maltreatment?
Bonnie's giving a thumbs up. I think that those are the kind of conversations that the larger community needs to have. Like I said before, the impact to families is because of all of the interrelationships between so many of these variables. I mean, we've mentioned incarceration, we've mentioned poverty. And I think, the educational system, I would say, is another one. And I think, we all need to have these conversations, which I think is, why we're starting with saying the place to begin is by acknowledging that there's a problem, understanding how it occurs by analyzing data. And I say that's not just data from the department, that's data from other parts of the system as well. Building relationships and communication and trust so that we can have these conversations as a whole, and then we can decide on the right approach, and really understand how much is poverty contributing to this, or how much of the disparity does that explain, and what are the limits on that? It may not. We often make these assumptions, and sometimes that may not be the entire explanation, and we don't want to lock ourselves into that. I think we need to do a thorough analysis of many different potential areas contributing that we can impact. So we've got our work cut out for us.
Thank you. I do appreciate, I think it's neat that you guys are looking at this data and that you're being so transparent about it. I think that serves our communities, and I'm excited. Thank you.
Thank you.
Thank you, Rita. I saw another hand. Was there another hand raised? Catherine, I'll just share with regard to the Diversity Council. I echo what Rita is saying, that that is a good step. And if there's a way that this committee can be helpful, either in in any aspect, whether it's putting together the council or once it's formulated, helping to make sure that we are sending out to information about it to the community. We are anxious to assist in any way we can. And for the members' benefit, I'll just share, if you have thoughts, I know you all have experienced this, but everyone at the department has an open door, open heart policy, and they're ready for your feedback. So if you have thoughts, I'm sure, sending them to Catherine, sending them to Director Faust, that would always be welcome. So free to go ahead and pass along thoughts based off of your experience and your interest. Any other questions, members, for Catherine? Okay, thank you, Catherine. That was an exceptional presentation.
Thank
and
you.
Gillian, thank you for your presentation as well. It's some great information. For the public's benefit, the entire slide deck will be posted to the DCS Community Advisory Committee webpage. And that's helpful. I'm sure we'll revisit some of those numbers in the future. I did hear Director Faust mention that the next strategic plan, iteration of the strategic plan, is going to have an item solely, its own item that will be focused on this. So that'll be exciting to see, and that's a great commitment to make this part of the core of what DCS is focusing on in the future. So thank you. All right, members, we'll move on in the agenda. We are not having a call for public comment. Just as a reminder, we're still finding our footing in terms of having public meetings amid the pandemic and the disruptions that have been there. And this meeting in particular, we did not advertise a call for public comment. We will not be taking public comment. However, let's transition over into setting the agenda for the next meeting. Members, I wanted to just start by recommending, now, I think we've now found our footing a little bit technology-wise. I'm not sure when it will be appropriate for us to meet in person again. It's probably too early for that. I haven't had any discussions with anyone at the department about that yet. But what I do think we could start considering would be to go ahead and find ways that we can open up our calls for public comment. I think the technology is there. We've had a successful run of meetings where we've had great presentations, but we really haven't had that input from the public. And I think even though it'll add some additional complexity layers to our meetings, that it would be good for us to provide some ways that we can interact with the public more. We have a long history on this committee of the information we receive from the public actually affecting future agenda items and our conversations with the department and even our recommendations to the legislature. So I wanted to just raise that with you because it was one of our decisions back at the beginning of the crisis to pause for a while on the public comment. But I think it's worth at least beginning this conversation about opening it back up. Does anyone on the committee have any comments with regard to that? Debbie, go ahead.
I know that school districts have grappled with the same issue as public entities. We typically have public comment at our governing board meetings, and the majority of the school districts are still not having those in person. Our school district went back to in person in August. And so we have, during the time that we were not in person, we allowed the public to send in an emailed comment that went to our board secretary, and those were read during the public comment time with the board agenda. However, there were times where we had over 100. Coming back to school has been a bit of a hot button. And so at those times, our governing board president has the right to limit. So we changed them from 3 minutes apiece to 1 minute apiece. I know also other school districts have done a 30-minute total time. So you might think about parameters of allowances of time, or somebody has to be the timer and then somebody else has to read them into the record. But that might be some possibilities for this committee to consider.
Thank you, Debbie. Jennifer, you have other comments?
So I have a similar comment. I also am on the governing board somewhere, and was just going to say that their policy is to have a written forum for the public to write in their comments, and then have somebody analyze those comments to categorize them for sharing out, so that instead of having to orally read each and every comment or have somebody speak for 2 or 3 minutes, they're in an archive somewhere written wise.
Okay.
And I guess
Thank you, Jennifer.
the only other thing I'd like to add is I do believe it's very important. So I think that we should, with undue haste, find a way to do something.
Thanks, Jennifer. Robin, you started to share, and you go ahead if you're still there.
Wanted to. I think the time has come to allow communities to speak at these meetings. So I'm just echoing and agreeing with you.
Okay, thank you, Robin. Bonnie?
I don't disagree with anything that anybody's already said. I think you've got some great ideas. My question is about, if we go to written comments, are there public meeting law requirements on notification and what gets done with those comments if they're in writing as opposed to in person? And I guess that's probably a question for Magdalena or somebody to to answer that. I just don't want to get us sideways with any kind of open meeting law.
It's a great, and I'm not sure, do we have, Magdalena, you're a lawyer, but do we have the counsel that is assigned to the committee available at this meeting?
Hi, yes, this is Magdalena. Hello, Mr. Chair. Yes, I believe I was invited as a temporary sub for Randy Alexander, who is our general counsel, who is unavailable at this time.
Terrific, thank you. Well, we have properly agendized an executive session. And so one option, members, is we could spend a few minutes with Magdalena in executive session and kind of talk out a few things. It would be a little bit complicated because we have to have some control on that. And so, you know, I'd need assurance from Felix and Armando that we can limit it to the appropriate parties for an executive session.
We are able to do that.
That's one option. Okay. Magdalena, are you open and available to do that if we were to have a little bit more of a logistical and legal conversation in the executive session?
I'm hoping I will be. I will do my best. We can discuss further under those circumstances.
I think it would help, even if what we're doing is flagging some issues, and then we can have more follow-up from the department over time. But it would help me as the chair to give the committee members a chance to ask you some questions, to raise some questions, and then I can take care of follow-up to make sure that we hash through all the legal issues and make the right decision in terms of opening public comment.
Yeah, absolutely. I'd be happy to move forward with that. I just want to ensure that all, I believe at this time, all staff would need to also dismiss themselves according to open meeting law, excluding myself.
Okay. Well, we've got two other. We need to finish this agenda item and talk about our meeting schedule. But it would be after those two agenda items. Debbie, you've re-raised your hand.
Thank you, Mr. Chair. Just as far as the open meeting law, I am assuming, and perhaps wrongly, that all the public entities are required to have many of the same parameters for the sunshine laws in Arizona. Perhaps not. The legal counsel will let us know. I just know that one of the formats that school districts use is we are required in our minutes to say who spoke and a general, not their entire comment, but a general idea of what their topic was.
Okay, thank you, Debbie. Okay, very good. Well, the members, if you have anything else to say, please raise your hand. But the gravamen of what I'm hearing is that there's openness to examine ways that we can reopen public comment. We're going to need to have a discussion with legal counsel, or at least begin the discussion with legal counsel about how we can do that, given our technology constraints. But I think it's an important discussion to have, and I really appreciate your guidance and your participation in that conversation. Let's keep talking about setting the agenda for the next meeting. Do any committee members have any requests for the agenda for our December 4th meeting, which will be our next regularly scheduled meeting and our last one of 2020? Bonnie, please go ahead.
I'd love to return to the data that we looked at today, both from Gillian and from Catherine, and kind of almost make that a regular part of our agenda to be looking at data. Whatever the department feels is important for us to see.
Okay, thank you, Bonnie. So two different areas, the COVID response and COVID analytics. I guess one question I have there that maybe we can did a follow-up presentation on the COVID analytics is there an array of data specifically set aside that the department would like us to be looking at so that we can track those numbers? Because some of the things that Gillian shared in her presentation, for example, were just new to me. I wasn't sure what was being tracked and what was available to be tracked, but that's some of that is a new data set, and so or at least new to me. So I'm curious about how we can follow that month over month, or if it's probably already knowing the very meticulous data tracking practices of the department. It's probably already available, but that would be helpful just in terms of a roadmap from my perspective. There was another hand raised. Did I miss it? There. Thanks, Jacob. Go ahead.
Yeah, so I think it'd be interesting to see what the legislative agenda is for the year. That'll be right before the session kicks off. So if they have any legislative updates that they'd like to share in terms of proposals for the year, I think that'd be helpful.
Agreed. Thank you. That makes a lot of sense. Our next meeting after that will be after the session has begun itself. So that would seem to be the most appropriate time. Felix and Magdalena, if you'd help me remember to make sure that we add that to the agenda for the December 4th meeting, I would really appreciate it.
Yes, I've written that down. As far as the data that you're looking for from Gillian and Catherine, that would be on COVID-19. Would that also be any further information on disproportionality?
I think the answer is yes, right, Bonnie? You were saying that we wanted to look at that more, and there are certain things that both Director Faust and Catherine shared that are ongoing actions that we could just be updated on. So a couple of months later, it'd be great to know what progress has been made on them.
Okay.
That would be my hope as well, is for what we saw today, but also on the horizon.
Okay, great. Members, other agenda items. I have two that we've talked about in the past that may or may not be appropriate by the time of our next meeting, but one, we talked about an update on the legal case. The department wasn't ready with a particular update at this time, but I'll be following up with them to find out if there's anything in particular. And I'm speaking about the class action in federal court. When I refer to the legal case, we had a briefing on that back in May, I believe it was. And Sergeant Laws isn't with us, I don't think, but he had asked some great questions in our last meeting, and I know the department is working on those. There's some detail that's involved with that. So if the response to his questions are available, that also might be something that I would agendize for the next meeting. Anything else, members? Sorry, go ahead, Felix.
I'll make note of that. I'll put that down and I'll speak with the proper people.
Great, thank you. Okay, well, that's this. If there's anything else about the December 4 meeting, members, that you'd like to request, remember the best way to do that is to send Felix an email in the interim. But the sooner you do that, the easier it is to make sure that that agenda gets planned in a comprehensive and thoughtful way. So thank you for your help and cooperation on that. Turning now to the schedule throughout the rest of the fiscal year, it's there printed in the agenda. We have February 5th, April 2nd, and June 7th. Any observations, members of the committee, about our schedule for the rest of the fiscal year? And Felix, do you have anything for us with regard to the schedule?
No, that should be good. I do want to remind everyone that if any member of the public
Great. Thank you, Felix. Thank you, members. Now what I'd like to do is take a vote on the question of convening executive session. That's agenda item number 7. And it'll take a motion and a vote, members, but basically what we need to decide is whether we will enter executive session to discuss agenda item number 4, which is the call to public comment, and how we would go about doing that in future meetings. Does anyone have a motion to make on that topic?
So moved.
I would like to second.
Thank you. Moved by Debbie and seconded by Bonnie. Members, all in favor of going into executive session pursuant to Arizona Revised Statutes 38-431.03A3, signify by saying aye, please.
Aye.
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 Thank you. Any nays? Okay, thank you. The ayes have it. At this time, we're going to dismiss the public and close out our meeting by going into executive session. I just want to thank all the members of the public for joining us. We had a substantial amount of participation, which is really encouraging, and I'm glad because there was a lot of good information that was offered by the department during this meeting. So thank you to the members of the public for the work that you play in helping children in your community, and thank you for your interest in the work of this committee.